Good day, my name is Imelda Williams. With this presentation, I'm going to focus on the appendicular skeleton and the girdles. And the main focus is going to be on normal variance. It's important that you view images that you are aware that there are a number of normal variations, because this can sometimes be confused with pathology. So it's important that you get used to looking at some of those very common normal variants. The main resource to be used is the book by Keats and Anderson, which is the Atlas of Normal Röntgen Variants that may simulate disease. And the latest edition is the 9th edition. This book is also called the Bible of Normal Variants. It's a really thick book, and it just demonstrates that there are thousands of variations when you look at the human body. So I would encourage you, if you don't have a copy in your department, to maybe find out whether your library or maybe the radiology library might have one. So if you're unsure, that you should be able to consult this book. Most of the time, normal variations tend to be incidental findings because normal variations don't normally cause any pathology or any pain. However, the discriminating thing is that if you incorrectly identify a normal variation as pathology, this then would be an incorrect diagnosis. So normal variations can simulate pathology. And it can also present problems in diagnosis, especially where the normal variation is the area where there is pain. So it could mimic fractures. Also, on the other hand, someone might think that it is a normal variant, and in fact, then it is also a pathology. It's useful to sometimes think about maybe taking an X-ray of the opposite side, as that can aid in making a diagnosis. Sesamoid bones versus ossicles. So sesamoid bones, they tend to be ovoid small bones, and they sit within a tendon or a joint capsule, and they're very common in the hands and the feet. The fibula and patella are also examples of sesamoid bones. Accessory ossicles are unfused secondary ossification centers, and they're found mainly in the carpus and the tarsus. They are very small bones, and they have well corticated margins. Sesamoid bones can also have variations. They can be bi, tri, or multipartite. They can also be uni, which means they can only be on the one side, or bilateral, where it could also be on the other side. So sesamoid bones could have a variable presentation, which sometimes make it difficult to distinguish it from a fracture. And here we have the patella. The most common presence of a normal variant on the patella is the superior lateral corner, and we can see on this image there is a bipartite patella, and here as well, but then on the image in the middle we can see that there is a multipartite patella. The reason why it's quite clear that this is not a fracture is because it's very well corticated on all three of these views. Here we have example of accessory sesamoids. You can see these little bones visible within the toe area. Sesamoids can also be partite. Very common, of course, is sesamoids at the first metatarsal phalangeal joint. The presentations, therefore, can vary. They can vary in shape and size and number, and they do not follow any specific rules. Bipartition may divide the sesamoid either into equal or unequal halves. It typically is either transverse or oblique. Very rarely a bipartition would be a longitudinal. So if you look here, you can see that you have got bipartition where one piece of the bone is much more bigger than the other, but you can see that the margins are very well corticated. And in the book of Keats, you will find that there are a lot of accessory ossicles. So this is just of the carpal bones, and then this is of the tarsal bones and of the feet as well. I'm going to mention some of the more common normal variants, and the first one is the osperonium, and it's an accessory ossicle which you find along the peroneus longus tendon. It varies in size, but it can also vary in number, and it can also be partite. It's classically found beside the cuboid bone as indicated on this image. The next one is the os infranaviculare, and it's an ossicle. It's very uncommon. It's found along the superior aspect of the naviculo-cuneiform joint, and is best seen on a lateral view. Os vesalianum is an accessory ossicle located at the posterior tip of the fifth metatarsal, and the presence of this ossicle is very rare, and its size and shape may also vary. It typically looks like a small rounded calcific density. One of the most common normal variants is the os trigonum, which looks, sometimes it can simulate an avulsion fracture at the posterior process of the talus. The os subfibulare is a normal variant at the tip of the distal fibula, and could inadvertently be called a avulsion fracture if there should have been any injury to that area. Next, I'm going to focus on epiphyses and versus apophyses. And epiphyses, as you know, is growth plates in the long bones. Some could be short and flat, but an epiphysis can also be cleft. An apophysis is a secondary ossification center and is characteristically sited at a bony prominence which acts as the insertion site for a tendon. For example, the tuberosity, where the peroneus brevis inserts at the base of the fifth metatarsal. Sometimes it can occur in irregular bones where growth takes away from the joint, for example, the calcaneus, and sometimes they may remain ununited. Here we have an accessory radial styloid process ossification center. And here's another accessory ossification center of the patella. On this view, we have a normal sclerotic appearance of the epiphyses of the radial head. And some of the other normal variants of apophyses. So that the first one on the left is at the base of the fifth metatarsal. If you look very carefully, you can see it's quite well corticated, and it is has a longitudinal direction. If this was a fracture of the base of the fifth, it would be irregular, and it tends to be either transverse or oblique. And here we have some ossification centers of the calcaneus, and then also of the tibial tubercle. Here's the lateral of the foot, demonstrating a bipartite medial cuneiform on the left, and on the right side a bipartite navicular. So you can see it can be very difficult to distinguish whether you are actually looking at a fracture or whether this is a normal variant. And therefore it's important to try and get hold of Kids' Book of Normal Variants. This image demonstrates a calcaneal pseudocyst. It can be very difficult to distinguish it from a proper cyst. The one way of doing that is by doing an axial projection of the calcaneus, and you will not be able to see the pseudocyst on the axial projection, so it's normally only seen on the lateral view. On this lateral of the elbow, we have the radial tuberosity, which simulates a focal lesion. And then we have on the distal part of the femur a fibrous cortical defect. and on the lateral view we have a posterior femoral defect. A fibrous cortical defect is normally smaller than a non-ossifying fibroma. They tend to be smaller than 2 centimeters, and also you normally don't see this in patients older than 30 years of age. Another normal variant is some bony islands, which we can see here in the distal tibia. Very common, of course, is the calcaneal spur, which can vary in size as well. Harris lines are growth-arrested lines. They typically last up to 10 days, and they occur due to severe malnutrition, infection, or starvation. In this image, we can see, especially in the middle and the lateral views, we can see there's multiple Harris lines, and each one of those actually indicates an area, a time period when there was severe malnutrition. It's really useful to have a copy of Keats and Anderson's textbook at hand, as there are thousands of normal variations, and you could then always consult the book if you are unsure whether you're looking at a pathology or whether this is a normal variation. Remember that normal variants can simulate disease and vice versa, where you might think that it's a normal variant, but it could actually be pathology. And as there are so many normal variations, never stop learning. So when you see something, always go and investigate it further. Put your nose into the book of Keats and Anderson, and that will help you to identify more of those normal variations. Thank you.